Everyone's raving about the miracle weight loss injections that supposedly melt away pounds with ease. You see them everywhere, celebrities endorsing them, friends flaunting their success, and doctors recommending them without a blink. But what if, behind that promised slimmer waistline, something far more unsettling is happening inside your body? Hair falling out in clumps, unexplained fatigue stealing your energy, and even some terrifying shifts in mood you never bargained for. These are the unexpected truths no one warned you about with GLP-1 agonists. I'm Dr. Hilary Lynn, and today we're ripping off the blindfold and getting real about drugs like Wegovy, Zepbound, and Ozempic. Stay with me, because at the end, I'll share a simple 5-step guide for how to protect yourself against these terrible side effects. So first of all, many of us have heard of the most common side effects: nausea and vomiting. Nausea is the side effect you hear about most because it affects nearly 1 in 3 people starting a GLP-1 agonist. Particularly in the early weeks, as somebody's body adjusts, the nausea can be bad enough to cause vomiting, especially if the dosage is ramped up too quickly or if you are particularly sensitive to a GLP-1 agonist. The good news is this nausea often fades as your body gets used to the medication. You can think of it as your body's breaking in period. In addition to the nausea, when someone starts a GLP-1 agonist, you might feel constipated or swing the complete other way and have diarrhea. It's all about how these drugs slow down your digestion. That slower digestion can also leave you feeling uncomfortably full, like you just finished Thanksgiving dinner but haven't even had breakfast yet. And of course, part of the reason why people take GLP-1 agonists is also behind some of its most significant side effects. The appetite suppressing effects of GLP-1 agonists are no joke. This can be a dream come true for many people trying to lose weight, but it can also make eating feel like a real chore. Some people even lose interest in eating altogether. It might sound ideal, but it can lead to serious issues due to malnutrition if you're not getting enough nutrients or losing weight too rapidly. One of the most common issues I find is that people start losing massive amounts of muscle mass. And this is a problem because muscle mass is hard to gain, especially as you get older. It takes more effort, more protein, more exercise to build up that muscle. And if you're losing muscle, you're going to be working 2x and for much, much longer to build that back up. So I encourage everybody who's on a GLP-1 agonist journey to also tackle the exercise as well. GLP-1 agonists can also increase your risk of gallbladder problems, including gallstones. And this is because rapid weight loss, no matter how it's achieved, can increase gallstone formation. So if you're already predisposed to having problems with your gallbladder, this is something to watch out for. Keep an eye on symptoms like a sudden pain in your upper right abdomen and talk to your doctor right away if you notice anything unusual. Because these drugs also slow down your GI digestion, you get something called delayed gastric emptying. It helps you stay full longer, but it can also mean way worse acid reflux. Some people just have a tolerable amount of that burning sensation, making more frequent appearances. But other people have really serious issues. Like I've had patients who have told me that they can't even lie down to go to sleep for 8 hours after their last meal because of how severe their reflux has gotten. If you're somebody who already deals with acid reflux, you might find this becoming a bigger problem than others. Then there are some more rare but serious side effects related to the GI system as well. Pancreatitis is very rare, but when it does happen, it's a serious condition linked to GLP-1 agonist use. So if you have severe abdominal pain, this is something that you should talk to a doctor right away about. In fact, you might need to go to the ER. That's how serious it can be. And like with any other drugs, there's a risk for allergic reactions. Everything from injection site rashes or even anaphylaxis are possible, although very uncommon. And then finally, people who have a history of medullary thyroid carcinoma or something called MEN syndrome 2 should avoid these drugs due to potential higher risks. If you're starting with a GLP-1 agonist, the key is to start with a low dose and go slow in increasing it. As you're also adjusting your diet, you might want to adopt smaller, easier to digest meals while still maintaining a focus on your nutrition. You might be now wondering why some people seem to just breeze through using GLP-1 agonists, while others really feel like they're just battling side effects every turn. The answer could be in your genes. So genetic makeup plays a crucial role in determining how your body reacts to the medications, whether it's the side effects you experience or even how well the drug actually works for you. This all starts with the GLP-1 receptor. The receptor is the target for drugs like Ozempic, Wegovy, and Mounjaro. Genetic variations, what we call polymorphisms in the GLP-1 receptor gene can influence both the efficacy of the drugs and the likelihood of bad side effects. So for example, if you carry the T allele at GLP-1 receptor RS2254336 or the A allele at RS3765467, you're more likely to experience GI issues like nausea and vomiting. I know that was a lot of letters, but basically all you have to understand is if you have certain genetic markers, starting on a GLP agonist might mean dealing with an upset stomach until your body adjusts. On the other side of the spectrum, genetic differences can make some people super responders to GLP agonists. So one particular variant, if you want to look this up in your genomics, is known as the RS6923761 or GLY168 serine variant. This is associated with improved glycemic control for some people. And if you have this particular variant, you're going to find that your blood sugar levels respond more significantly, giving you a better metabolic outcome. And this genetic variant is more common in specific populations, particularly Hispanic, American Indian, and Alaska Native groups. So people from these backgrounds might see greater benefits from GLP-1 agonists compared to other groups. In fact, studies suggest that these populations might have better overall results from treatment compared to white European populations who have a lower frequency of this advantageous variant. Genetics are only part of the story. The biological pathways involved in how GLP-1 agonists work are also crucial for understanding different responses. So one key player here is beta-arrestin. This is a protein that helps regulate cell signaling. The way your body recruits beta-arrestins when you take a GLP-1 agonist can impact both the drug's effectiveness and any side effects. So reduced levels of beta-arrestin recruitment can enhance insulin secretion and make the medication's effect last longer. This makes the drug more powerful for some people. Finally, not all GLP-1 agonists are the same. So even though they're all part of the same class and they kind of do the same thing, they all have distinct pharmacological properties that affect how the drug binds to receptors or is metabolized by the body. These differences impact not only the drug's effectiveness, but also the likelihood of experiencing side effects like nausea or appetite changes. So if you're not doing well with one particular drug, you might want to ask your doctor to switch to a different kind. There are differences that are known in broad populations, but there's also subtle differences seen in different individuals. The effectiveness of GLP-1 agonists, as we've seen, is not the same for everyone. So some people see better outcomes than others, and it's not just due to the genetic factors we talked about. It sometimes has to do with what conditions you have already. People who have type 2 diabetes, who also have cardiovascular disease, are some of the biggest beneficiaries of these GLP-1 agonists. So if you have heart disease and you have diabetes, that is overall not great news for your health. But the positive side is these types of drugs can have a powerful benefit for you. We see reduced risks of heart attacks, strokes, and other major cardiovascular events in these populations. And this is why major medical associations like the American Diabetes Association recommends GLP-1 agonists now as first line for people with type 2 diabetes and established cardiovascular disease or high heart disease risks. Similarly, people with type 2 diabetes and chronic kidney disease also tend to benefit greatly from GLP-1 agonists. So these drugs have been shown to improve both cardiovascular and kidney outcomes, particularly in people with advanced chronic kidney disease. So that's stages 3 to 5. This means better blood sugar management and less reliance on insulin, while also offering kidney protection, a significant benefit for individuals at risk of worsening kidney function. GLP-1 agonists also have shown benefits for those with diabetes plus heart failure. So the GLP-1 agonists are associated in studies with a reduced risk of hospitalization and death due to heart failure, making them a valuable part of treatment for people struggling with both diabetes and heart failure. Finally, people who have immune disease like rheumatoid arthritis and lupus plus diabetes have better outcomes with GLP-1 agonists. And not related to any particular health condition, but people who are older also tend to have more significant outcomes with GLP-1 agonists. In particular, we've noticed in studies the reduction of the risk of major heart disease events. For people who haven't had great success with standard oral anti-diabetes meds or lifestyle changes for their obesity, these drugs can offer a new level of control over blood sugar and body weight. This is especially true for people who have experienced a lot of weight cycling or yo-yo dieting, where the appetite-suppressing effects of GLP-1 agonists can finally help stabilize weight and improve metabolic health. And if this all isn't working out for you, talk to your doctor about combining your GLP-1 agonist with other medications like metformin or sodium glucose cotransporter 2 inhibitors, SGLT2 inhibitors, because this can further enhance your outcomes, particularly if you already have atherosclerotic cardiovascular disease, also known as ASCVD, or the risk factors for ASCVD or chronic kidney disease. These combinations are recommended by many medical groups, so you can rest assured that this has been well studied. We've seen this in many thousands of patients so far, and it really reduces the risk of major adverse cardiovascular events, heart failure hospitalizations, and the progression of kidney disease. So now I want to dive into some of these more mysterious or lesser known side effects of GLP-1 agonists. If you are starting a GLP-1 agonist and finding that your energy levels are lower than usual, you're not alone. Fatigue and low energy are common complaints that we don't talk about enough with GLP-1 agonists. But why does it happen? It turns out that Ozempic, Mounjaro, Zepbound, these drugs affect energy metabolism in several different ways. So initially, these meds reduce your energy intake by decreasing your appetite and slowing your gastric emptying. Essentially, they're making your stomach empty food more slowly and make you feel full longer and eat less. This is helpful for weight loss, but it can also lead to a temporary drop in energy because your body is getting fewer calories to work with as it adjusts to this change. Another important effect is how GLP-1 agonists influence your fluid balance. They affect your thirst perception and reduce it, which means you might not feel as thirsty as you normally would, and this can lead to dehydration. They also promote something called natriuresis, which is just a fancy word for losing more sodium through your urine, and diuresis, which means increased urine output. Both of these effects mean that your body is losing more fluid all the time, which can make dehydration and therefore fatigue much more likely if you're not staying properly hydrated. I even had a patient recently who has been aggressively tackling his weight, and unfortunately, because he was trying to get enough protein and veggies in his diet, he wasn't able to fit enough water in his stomach apparently. And this led to him getting quite dehydrated to the point where his urine was changing color, even getting a little bit brownish. And that's a dangerous effect. Luckily, we caught it in time, but sometimes you can dry up your kidneys so much that it can lead to severe damage or more long-term negative effects. GLP-1 agonists can also impact your body's response to stress. It affects something called the hypothalamic pituitary adrenal axis. This is the system that helps regulate how our body responds to stress. So some studies show that GLP-1 agonists don't significantly activate the HPA axis long-term, but they might alter stress responses in a way that contributes to fatigue for certain people. That's a convoluted way of saying it's a bit mysterious, but due to certain genetic and biological reasons, our stress response changes differently in different people to GLP-1 agonists. And of course, we talked about muscle mass and how people are at risk of losing it while on GLP-1 agonists. So if you do lose muscle while on GLP-1 agonists, especially if you're older or already a bit frail, you can actually feel fatigued because muscle is really important for maintaining your energy and strength. Interestingly, GLP-1 agonists can increase your energy expenditure over time. So this means that your body actually starts burning more energy. A lot of people ask me all the time, they're like, oh my gosh, is my metabolism going to slow down because I'm eating so much less? And actually, scientific studies have shown that the opposite is true. So why does this happen? This happens because GLP-1 agonists actually activate something called brown fat or brown adipose tissue. This is a type of fat that burns calories to generate heat and is found a lot of times actually in small creatures like babies or even in rodents like mice. So by promoting the transformation of white fat, the type that stores energy and the type that we mostly have, into a more metabolically active form, the brown fat, this increases energy burning. A fun fact is this process is actually called browning. So this is great, of course, for weight loss and boosting your metabolism, but it actually makes you feel tired initially as your body is adjusting to these changes. The resting energy expenditure of your body also increases with prolonged treatment, which might impact your energy levels until your body adapts. So the good news about all of this is that this low energy phase often improves as your body adjusts to the medication. So during the adjustment period, several things are happening. Your digestion is slowing, your appetite is decreasing, and your body is recalibrating energy use. So this means your body's figuring out how to work efficiently with fewer calories, which can initially lead to lower energy availability, making you feel sluggish. And don't forget about the fluid balance, because you're urinating more salts out and more fluids out, and also you're not feeling thirsty as much, you can easily get dehydrated. So make sure you're staying on top of proper hydration with electrolytes, and even more so than when you are not taking GLP-1 agonists. So here are some quick tips to boost your energy levels, or at least make sure they don't fall too much when you're starting GLP-1 agonists. First, you want to prioritize balanced nutrition. Make sure you're eating nutrient-dense food, even if your appetite is lower. GLP-1 agonists reduce energy intake by making you feel longer, so it's crucial to make every meal count. Focus on protein, which helps you maintain your muscle, healthy fats, which provide sustained energy, and complex carbohydrates, which keep your blood sugar stable. This combination will also help support your muscle function and keep your energy levels steady. This is not the time for highly processed junk foods. Those empty calories are not going to nourish you. They will make you feel full, certainly, but you'll just grow malnourished if you're relying on junk foods. Also, of course, you want to stay hydrated. Because the GLP-1 agonists reduce your sense of thirst, you're going to need to increase your hydration even more than your body is necessarily telling you. Then, of course, you want to exercise, but take it easy at first. Moderate physical activity can boost your energy levels over time, but you don't want to push it while you're feeling overly fatigued. In the beginning, you want to try walking, light resistance training, or yoga to improve that circulation and reduce fatigue. Exercise also helps activate that browning process where you convert your white fat to the brown fat, and that will help you burn calories more efficiently and ultimately increase your overall energy levels. And if you have diabetes, you're going to want to monitor your blood sugar levels. GLP agonists can help regulate your blood sugar, but fluctuations can still occur, contributing to that low energy feeling. Maintaining your stable blood sugar is key to feeling steady and avoiding energy crashes. Low energy might be common, especially in the beginning, but if it persists or worsens as you take a GLP agonist, it's worth exploring other potential causes. Severe fatigue can indicate nutrient deficiencies or other side effects of the medication. So work with your doctor to rule out any serious underlying conditions. Over Thanksgiving, I had an interesting conversation with a relative who is a hairstylist. It turns out that we've both been noticing that many people on GLP-1 agonists seem to be having trouble with hair loss. So my relative mentioned seeing more clients coming in with complaints of thinning hair, especially people who had recently started Ozempic or similar. And it made me realize just how many people have recently been coming to me with the exact same complaint. So let's dive into what we know. The connection between hair loss and GLP-1 agonists is something that researchers are actually still investigating. A real-world study looked at multiple data sources and found that GLP-1 receptor agonists, including semaglutide, liraglutide, and dulaglutide, were the most frequently reported anti-diabetes medications linked to hair loss. However, it's important to note that these reports didn't meet the criteria for a definitive signal, meaning that while there were more reports of hair loss with these drugs, we don't yet have enough evidence to prove a direct cause and effect relationship. That being said, there are a few theories that might help explain why hair loss could happen for some people starting these GLP-1 agonists. One theory is that GLP-1 agonists might interfere with the natural cycle of hair growth. So these medications influence metabolic processes and hormone balances, which might impact the hair growth cycle, causing it to slow down or pause. Hair growth happens in cycles. Anything that disrupts these cycles can lead to shedding or thinning. Another theory is that GLP-1 agonists might trigger something called premature androgenetic alopecia, particularly in people who are already genetically predisposed. Androgenetic alopecia is a fancy scientific term for male pattern balding. So the metabolic changes induced by these drugs might accelerate the onset of this male or female pattern balding, although this is still speculative. I've definitely seen this in my patients, however, so I think there's something to this theory. So the theory that I personally think is the most impactful is that while you're losing weight rapidly, you end up with nutritional deficiencies. So this is particularly true with GLP-1 agonists. The rapid weight loss can lead to deficiencies in key nutrients like protein, collagen, vitamins, and minerals that are crucial for maintaining healthy hair. Personally, even when I was practicing some prolonged fasting, I experienced significant hair shedding. And this was likely due to the lack of adequate protein and other nutrients during that period. So without enough protein, which is essential for hair structure, or adequate vitamins like biotin and iron, hair health can seriously suffer. And like I touched on briefly, hormonal imbalances might also be at play. When the body is relatively malnourished of nutrients due to rapid weight loss, this can lead to shifts in hormone levels, and this can indirectly affect the hair growth cycle, contributing to the increased shedding or hair thinning. Interestingly, GLP-1 agonists improve your insulin sensitivity and enhance blood flow, including to the scalp. This is actually beneficial, but it can have complex effects on hair follicles in some people. So the enhanced blood flow could paradoxically lead to changes that contribute to hair shedding in the short term. From what we know so far, people with type 2 diabetes or people who are overweight or obese and taking GLP-1 agonists seem to be the ones most likely to report hair loss. This could be due to the combined effects of metabolic changes, potential nutritional deficiencies, and pre-existing hormonal imbalances that might be exacerbated by the medication. If you're experiencing hair loss while taking a GLP-1 agonist, it's really important to discuss it with your doctor. They might recommend some testing and other ways to ensure you're getting the adequate nutrients you need, or suggest some other strategies to minimize the hair shedding. With all the excitement surrounding GLP-1 agonists, we often hear about their incredible effects on weight loss and blood sugar control. There's another aspect that isn't getting nearly enough attention: the potential psychiatric effects of GLP-1 agonists. The mental health impacts are so important and complex and deserve more of the spotlight. On the one hand, there's some evidence showing that these medications can improve the mood for some people. But on the other, there's reports of some serious negative mental health effects, ranging from increased anxiety to more severe outcomes like suicidal thoughts. One community-based study showed that people with obesity who were treated with GLP-1 receptor agonists, such as liraglutide and semaglutide, has significantly increased risk for psychiatric issues. Specifically, there was a 195% higher risk of developing major depression, a 108% increased risk for anxiety, and a 106% elevated risk of suicidal behavior compared to those not taking these medications. These numbers are concerning, especially given the widespread use of these GLP-1 agonists for weight management. There was another study using data from the FDA Adverse Event Reporting System, which highlighted the various psychiatric adverse events linked to GLP-1 agonists. So this included nervousness, heightened stress, eating disorders, sleep disturbances, and even self-induced vomiting. So clearly, these medications have the potential to affect mental health in ways we're just beginning to understand. But I don't want to leave this in a completely negative light. There is emerging evidence suggesting that GLP-1 agonists may also have antidepressant effects. So a systemic review and meta-analysis pointed out that these medications might reduce symptoms of depression, particularly in people with type 2 diabetes. Some preclinical studies on animals have also shown that chronic administration of GLP-1 agonists can reduce depression-like behavior, hinting at some kind of mood stabilizing properties. So the dual nature of these psychiatric effects, both positive and negative, makes it crucial to have a nuanced understanding of how these drugs interact with our mental health. The context of each person's health, history, and the dose and duration of the medication could all play a role in determining whether someone experiences a benefit or a risk. Not to muddle it up, but it seems that the mental health effects also vary depending on factors like dosage, age, and gender. One study suggested that people taking GLP-1 agonists for longer than 180 days experienced a reduction in anxiety, suggesting that it's the prolonged use that might help mitigate the psychiatric risks. However, we still don't really precisely understand the relationship between dosage and mental health effects. Gender and age also seem to play important roles. Data shows that mental health adverse effects are more commonly reported in women, almost 66% more than in men, and the median age of those affected was around 56 years. So that suggests that middle-aged women might be particularly susceptible to psychiatric side effects from GLP-1 agonists. However, there was also a slight increase in reports of suicidal thoughts or behaviors in younger patients, particularly children, indicating that these risks might just vary across age groups in complex ways. So why might these GLP-1 agonists affect mental health at all? There's some potential mechanisms that researchers are exploring. GLP-1 receptors are not only found in the pancreas and gut, but also in the brain, particularly in areas that regulate mood and stress. So this suggests that GLP-1 receptor agonists might directly influence brain function, potentially altering our mood and anxiety levels there. These medications also impact our hormones that regulate hunger and stress, such as cortisol and insulin. Disruption to these hormones might lead to increased stress or anxiety in some people, while in others, it might help stabilize their mood. It all depends on the baseline hormone levels and how they shift with the medications. And of course, GLP-1 agonists are well known for their ability to affect appetite and change eating behavior. This is really helpful for weight loss, but it can also lead to disordered eating patterns or exacerbate existing ones. When I'm treating patients, that one of the first questions we ask is whether you have a history of an eating disorder. And for someone who finds comfort in food, whether or not you have a clinical disorder, the sudden lack of interest in eating might contribute to feelings of depression or anxiety. This is why I think it's so important to look at someone's life contextually and make sure that we're covering all our bases. You want to make sure that you have a supportive environment as you're embarking on the weight loss journey. So if you're somebody who has a history of mental health challenges, discuss this with your doctor before starting a GLP-1 agonist. People of middle age, particularly women, appear to have higher risk of psychiatric side effects, and younger patients also might have unique challenges. So after covering all these potential side effects of GLP-1 agonists, ranging from mental health issues to hair loss to energy dips, you might be wondering how to use these medications effectively while minimizing all these risks. Here I'm going to go through some practical steps to help you make informed decisions and manage your personal potential side effects, helping you keep control of your health journey. So step 1, think about your goals. Are you focused on losing weight, managing your type 2 diabetes, addressing your heart risk factors, or longevity overall? These drugs are powerful, but it's very important to weigh the potential risks, such as a psychiatric side effect or nutrient deficiencies that may occur. Work with your doctor closely to discuss these pre-existing conditions or potential risk factors. If you have a history of mental health issues, for example, it's important to consider the possibility of increased anxiety or depression at the time, and you might even want to embark on the mental health journey first before starting the GLP-1 agonists. 2, you want to start low and go slow in terms of increasing dose. Many side effects, like the nausea and GI issues, are minimized by allowing your body time to adjust. Your doctor is probably going to recommend some kind of titration schedule, but just remember that not everybody is the same. I know there's a tendency across the board for people to just follow a certain schedule according to protocols at a clinic, but everybody is different. If you're doing well at a certain dose already, it means that you might not need to increase the dose. A gradual approach can also help reduce mental health bad effects by giving your brain and body more time to adapt. It's really important to monitor your mental health throughout the entire process. Track your moods, anxiety levels, and any changes in your sleep or appetite. If you do notice increased feelings of sadness or anxiety or thoughts of self-harm, reach out to someone immediately. Not only your doctor, but family and friends can be helpful. Also, focus on nutrition and hydration. Because the GLP-1 agonists reduce your appetite, it carries the risk of malnutrition. Make every single meal count by focusing on nutrient-dense foods. Prioritize the protein to maintain your muscle mass and hair health. Include leafy greens, nuts, seeds, and whole grains to provide the essential vitamins and minerals to support your physical and mental health. And if needed, consider supplements like collagen, iron, or B vitamins, especially if you've had some kind of gastric bypass or bariatric surgery. And remember, these meds also reduce your sense of thirst and increase your risk of dehydration. So make sure you're drinking enough water, even if you're not immediately feeling thirsty. Keep a water bottle around with you and just drink consistently throughout the day. Exercise can also help manage the side effects like low energy and mood changes. It doesn't need to be intense. Even walking for 30 minutes a day or practicing some gentle yoga can boost your mood, help with fatigue, and support muscle mass. Physical activity also stimulates blood flow, which can support hair health and energy levels. If you're experiencing hair thinning or loss, talk to someone. At the very least, you need testing to make sure that you aren't suffering from micronutrient deficiencies, thyroid issues, or something else. We often can get through the hair loss problem by getting enough nutrients like protein and adding supplements like B vitamins and addressing hormonal imbalances from rapid weight loss. And finally, reevaluate your progress frequently and consider combination therapy as needed. Your experience with GLP-1 agonists might change over time. The side effects that were bothersome initially might improve, while others might develop later. If you have regular check ins with your doctor, you can assess frequently whether the medication is still right for you. And if you can't go higher due to negative side effects, but you still have a ways to go in terms of your weight loss or other health goals, you might want to use combination therapy. Whether it's something like metformin or an SGLT2 inhibitor, you might get additional benefits without worse side effects. This is actually a pretty common practice across many medical fields. It turns out that by using different types of medications at lower doses often produces fewer side effects than increasing one medication to a higher dose. So GLP-1 receptor agonists offer such promising benefits for managing weight, blood sugar, and even heart health, but they come with serious challenges that don't get talked about enough. Be proactive. Monitor your mental health, your nutrition, your hydration, so that you can maximize the benefits of these medications while minimizing their downsides.